So now to talk a little bit about the presentation of preeclampsia. It's usually an asymptomatic disease that's picked up on screening, but in the later, more advanced stages, it can start to become symptomatic. These include neurological symptoms like visual disturbances, headaches, drowsiness, and nausea and vomiting, and all of these indicate that the patient's progressing towards eclampsia. Similarly, if they start to get epigastric or hypochondriac pain, that's an indication of liver involvement, which also indicates progression towards HELLP syndrome. And as we mentioned before, they can get edema. This is not a very specific sign because this is quite normal in pregnancy. But if there was a sudden change in the amount of edema they had, that could be considered a sign. So I'm going to talk a little bit about the pathogenesis. If you remember anything about what causes preeclampsia, remember that there is defective spiral artery remodeling. Now, in a normal pregnancy, this takes place between weeks 8 and 11, going off the last menstrual period. And just there's a little anatomical diagram here so that it's clear what I mean when I say spiral artery, and it's the end point of the maternal blood supply that nourishes the fetus. So this is what happens normally in spiral artery remodeling. So again, this is around weeks 8 to 11, and the little blue dots represent cytotrophoblasts, and those come off the conceptus and invade along the walls of the spiral arteries, and they go down through the decidua and into the myometrium. And so you should have this by the time the spiral artery remodeling is complete. Now you'll notice the artery has become far wider than it was previously, so it's going to deliver an awful lot of blood to the conceptus. And it's also invaded down into the myometrium. By contrast, this is what happens in preeclampsia. So you can see the cytotrophoblasts haven't gone as deep as they did in the normal picture. And now you can see the artery is less wide. This is a problem, but not the biggest issue. The biggest issue is that they haven't invaded down into the myometrium. And that means that there's still this contractile portion of tissue around the vessel, and that will restrict the amount of blood getting to the fetus. And we'll just talk a bit more about that now. So the spiral arteries in preeclampsia, because they don't remodel properly, are narrow, they're high pressure, and that myometrial segment retains contractility. All of this leads to insufficient blood supply to the placenta. This causes ischemia, which, as with most tissue, damages it. There's also variable flow from these vessels because we talked about that contractile segment because the myometrium doesn't get invaded by the cytotrophoblasts. So during the pregnancy, in response to various stimuli, that myometrium can contract and limit the amount of blood getting to the fetus. Now, at some point, the myometrium will relax and restore blood flow to the fetus, but that variable oxygen tension, that ischemia reperfusion injury, creates oxidative stress, which also damages the placenta and damages it more than pure ischemia would. These two factors combined mean that microparticles of placenta and various placental factors break off and enter the mother's bloodstream. A certain amount of this in pregnancy is normal and can be tolerated by the mother, but when you have this increased entry of particles from the placenta into the maternal bloodstream, then you start to get the problems associated with preeclampsia. So these microparticles and these placental factors break off from the placenta and they deposit in the endothelium. And that's the key to what causes the symptoms and signs of preeclampsia. It's endothelial dysfunction. So the endothelium doesn't produce as many vasodilators as normal, so things like nitric oxide and prostacyclin, and so you get vasospasm. These damaged and inflamed blood vessels also become more permeable, so you get edema. And this also increases coagulation by stimulating more inflammatory states of the endothelium, and we'll talk about that a bit more when we come on to complications. So if these microparticles deposit in arteries, then you get the vasospasm we talked about, and that's what leads to the hypertension. It's that decreased vasodilator production. If they deposit in the arteries of the brain, then that same vasospasm causes the signs of eclampsia and the neurological symptoms of preeclampsia. And if these microparticles deposit in the kidney, then you get leaking and the proteinuria associated.